Hello and welcome. You are watching Gravitas Plus. I am Molly Gambhir. Have you heard of the term superbugs? Well, simply put, they are bacteria resistant to antibiotics, which makes them a menace and a global health threat. How can they be tackled? How serious is the threat in India and around the world? First, here's a bit more about superbugs and drug resistance. Drug resistance occurs with the overuse of antibiotics and other antimicrobials, which allows some bacteria to evolve into superbugs that are not affected by the medicines. Antimicrobial resistance happens when germs like bacteria, fungi, develop the ability to defeat the drugs designed to kill them. That means the germs are not killed and continue to grow. Resistant infections can be difficult and sometimes impossible to treat. Antimicrobial resistance is a naturally occurring process. However, increases in antimicrobial resistance are driven by a combination of germs exposed to antibiotics and antifungals and the spread of those germs and their resistance mechanisms. In fact, antimicrobial resistance is a major public health concern. It is an urgent global public health threat. It has been identified as a global health threat with serious health, political, and economic implications. Just to break this down for you, it poses significant risks, particularly in surgical procedures, cancer treatment, other critical healthcare interventions, for example. It leads to delays in treatment, thereby increasing the risk of spreading resistant microorganisms and healthcare costs and the economic burden to families and societies at large. In India, the second version of the National Action Plan on Antimicrobial Resistance has been launched. The Union Minister of Health and Family Welfare has said that the overuse and misuse of antibiotics has unfortunately become a common practice, underscoring the urgency of corrective measures. And so, several initiatives have been undertaken in this regard. Earlier, an alarming study shed light on the antibiotic resistance situation in India, according to which more than 80% of Indian patients carry multi-drug resistant organisms, the highest globally. To be precise, it says 83% of patients carried these organisms. What does that mean? Conditions linked to higher multi-drug resistant organisms prevalence, including chronic lung disease, congestive heart failure, frequent hospital admissions, or prior procedures. The presence of these organisms forces hospitals to use stronger and more toxic drugs, prolongs recovery, increases the risk of complications, and leads to substantially higher treatment costs. The large-scale international study published in the Lancet E-Clinical Medicine Journal has warned that India is at the epicenter of a superbug explosion, as several patients in the country were found to carry multiple highly resistant organisms simultaneously. For India, where nearly 58,000 newborn deaths each year are linked to resistant infections, and where untreatable bacteria are frequently encountered in ICUs and cancer centers, the study provides unmistakable evidence that antimicrobial resistance has become a national health emergency, is what the researchers have said. They recommended that healthcare professionals and citizens use or prescribe antibiotics more carefully and responsibly so that they remain effective for longer. Also, regulating the sales of prescription-only drugs, routine pre-procedural screening, considering single-use devices for high-risk patients to avoid transmission can also be helpful in order to tackle the antimicrobial resistance burden. Antimicrobial resistance is one of the world's most urgent public health problems. Earlier, a CDC report said antibiotic prescriptions can be appropriate when risks for bacterial or fungal infections are unknown, but that it puts patients at risk for side effects and creates a pathway for resistance to develop. There's also the question of what can you do? Antimicrobial resistance can affect people at any stage of life, like we said. Infections caused by resistant germs are difficult and sometimes impossible to treat. In many cases, these infections require extended hospital stays, additional follow-up doctor visits, and treatments that may be costly and potentially toxic. Prevent infections in the first place, if possible, is the advice that's generally given. Healthy habits can protect you from infections and help stop germs from spreading. Talk to your healthcare provider, your doctor, about whether antibiotics or antifungals are needed. Also, improve antibiotic and antifungal use to slow the development of resistance. Consult a doctor at all times. Stopping the spread of antimicrobial resistance is crucial. We all have a role to play. Making informed choices after guidance and due consultation from a doctor and collective action is the need of the hour.